I want to express a special welcome and thanks to Councilmember Brianne Nadeau and Department on Disability Services Director Andrew Reese and Deputy Director Winslow Woodland for joining us today. First, a few housekeeping matters. Next slide, please. Next slide, please. We are recording this meeting. Closed captioning and ASL is available during the meeting. If you would like closed captions, please click the icon and select subtitles or a separate page of live captioning. If you're having audio issues, we advise that you call in using a telephone and use the audio settings features, which can be found by clicking the up arrow next to the microphone. If you are on the phone, if you want to, we're going to mute everybody, but when it comes to the Q&A at the end of the session, you would hit *6 to mute or unmute. And during the Q&A, we'll have an option of either posting questions in the chat or unmuting and answering questions. We ask that everybody stay muted until then, but if you have a technical question or a question for clarification, you can put that in the chat and we'll try to deal with it as we go. And please use the gallery view if you'd like to see as many participants and reactions as possible. Next slide, please. Is there a next slide? Or take the slide down, please. At the end of today's forum, we're going to ask you to complete a short survey. We and our funders want to know if we're giving you the information you want and need, and your responses help us continue to improve. So we'll ask you to please answer that. We're here today to discuss the Developmental Disabilities Eligibility Reform Amendment Act, or the DDERAA, which is poised to become law in DC, and will revise the eligibility criteria for services from the Developmental Disability Administration of DC's Department on Disability Services. This is an important moment for DC residents with developmental disabilities, their family members, advocates, and other supporters, and we thank you for joining us for it. By modernizing the criteria for determining eligibility for DDA services, this act is a significant step in the decades-long effort to address inequities faced by DC residents with developmental disabilities and to create a community-based system that supports all DC residents with developmental disabilities to live the self-directed lives of their choice. It's my pleasure now to introduce Ward 1 Councilmember Brianne Nadeau, Chair of the Committee on Human Services of the Council of the District of Columbia. After hearing testimony from people with developmental disabilities and their families about the impact of the lack of services in DC on many adults with developmental disabilities, Councilmember Nadeau introduced the DDERAA. She and her staff worked with advocates in the administration to refine the bill and shepherded the bill through the council. Thank you, Councilmember Nadeau, for everything you did to pass this important legislation and for all of your efforts to advance equity for people with developmental disabilities in DC. Turn things over to you. Thank you.
Well, thank you so much, Robin. I've spent a long time envisioning this day, and it's amazing that it has finally arrived. I'm sure many people at this forum have anticipated today for even longer, and I know many of you came to me and the Human Services Committee with the stories, the knowledge, and the advocacy that made this all happen. From nearly the time that I took over as chair of the Committee on Human Services, it has been clear that we could be doing so much better when it comes to supporting our residents with developmental disabilities. Many who were assessed with an IQ score higher than one associated with a diagnosis of an intellectual disability were denied eligibility for DDA services. This was happening to many residents regardless of their real need for services. This was a problem that was especially acute for those aging out of developmental disability support services received in school. Many residents with DD received in-school services intended to help as they developed into adulthood, but were faced with a cliff of support as soon as adulthood was reached. We on council heard this message loud and clear, thanks to tireless advocacy from this very community who came out for almost every performance and budget oversight hearing for DDS to make this problem known. Thanks to that advocacy, in 2020, I convened a working group comprised of experts and advocates, my council colleagues, DDS, and the Department of Healthcare Finance. From the beginning, I was very encouraged by the collaborative spirit of those working groups by everyone involved. Advocates shared how they believed a broadening of services to individuals with just developmental disabilities could have a greater positive impact. And DDS and its agency partners helped us understand the challenges of such a proposal. That working group ultimately resulted in legislation, the Developmental Disability Eligibility Reform Amendment Act. I introduced this bill on May 21st of last year, along with Council members Silverman, Trayon White, Robert White, Allen, Bonds, Lewis, George, and Shea. And I can't believe our timing, because I am pleased to report that a little under a year from the day that bill was introduced, the bill to expand eligibility for developmental disabilities is now law as of today, May 19th, 2022. Council's also about to pass a budget that fully funds the bill so that DDS, as they have assured me, can start accepting people and offering services as soon as the new fiscal year starts this October. I am very glad this event was pulled together as the start of the on-ramp for advertising this important policy change at DDS. I'm going to wrap up and let us get to the heart of the discussion. But before I go, there is just no way I can get to everyone, but I want to acknowledge just some of the people who helped get us to this moment. And by their tireless work in pushing both the council and the agency forward. Bob Williams, Sandy Bernstein, Carol Grigsby, Tawara Good, Tina Campanella, Robin Schaffert, Thelma Green, Thomas Mangrum, Ricardo and Donna Thornton, and the rest of Project Action, Ian Paragal, Jermaine Payne, Yetta Myrick, Laura Lorenzen, Morgan Whitlatch, Allison White, Paul Letter, Molly Whalen, Allison Arrington, Nancy Eby, and Jeanette Shelby, and Uchenna Aganetti. And of course, Director Andy Reese and his staff. I am so excited to see what we can do starting this year to change many people's lives for the better. Thank you. Thank you all for having me here today. I am just thrilled that we've made such progress together.
Thank you, Councilmember Nadeau, for joining us on this important and fortuitous day. And next, we'll hear from Sandy Bernstein, the Legal Director of Disability Rights DC, who will tell us more about the new eligibility criteria.
Great. Can everyone hear me? Okay, great. So I'm so excited. I can't even tell you how excited I am that this law has passed and that I'm here to talk to you about it. So I'm going to talk to you about what is the Developmental Disability Eligibility Reform Amendment Act of 2021. I can have to, let me just get to the next. It's not, my slides are not showing up. There we go. So why was this law needed? As you heard from Councilmember Nadeau and Robin, DDA currently only provides services to adults with intellectual disabilities. And what does that mean? It means that people have to have a certain IQ score, which for DC, it is an IQ score of 69 or below with consideration of the standard error of measurement, which is basically plus or minus 5. So they basically have to have from 64 to 74 of an IQ and also have adaptive functioning deficits, which means sort of how does somebody navigate in their environment. And so if they don't have that, even if they have another developmental disability or they have a developmental disability, they are not qualifying for services. And this really is unlike pretty much every other state in the country. DC is only one of then 4 other places, or actually 5 other places. It's DC and 4 other states who actually limit services from their DD agency to only people with intellectual disabilities. So we really needed to get with the times in DC. Because what was happening is what is happening still is that people with developmental disabilities who don't have this IQ score have been unable to access community-based services. And as you heard from the council member, you can have somebody who just say is autistic and was getting a lot of services while they were in school. Maybe they were even in a specialized non-public school and they had, but they have an IQ just say of 85, or maybe they have an IQ of 110, but they have significant needs in terms of maybe they need help in the home, maybe they need behavioral support, but they need help to live in assistance to live successfully and safely in their community. And until this law was passed, or until it does actually go into effect, there really aren't services available for that person when that person graduates from school or or maybe they're older and they need services now. So there are limited services right now for employment that are time limited. And if someone has a physical disability, they can get services to help with their activities of daily living. If someone needs help with going to the bathroom and eating and transferring, those services are available. But in terms of people who might need more support in their home, or they may want more employment options or different day program options, those are not available. All right, I'm getting a notice that my speaking voice is too quiet. Is that true?
Please go ahead.
I can.
No, you're fine.
Okay, it's fine. Oh, and now there's a motorcycle behind me. Thank you. Can somebody move it forward? Thank you, because I'm having difficulty right now. Thank you. So as you heard, there was great, and I apologize for the motorcycle behind me, but there was great charge from the community to really advocate for change. And this wasn't a group of lawyers who just got together. These really was the community coming together in DC, which were people with developmental disabilities, family members, advocates, including lots of self-advocates who really said there needs to be a change, like time has come. And we did it in any way we could with the community, whether it was testifying before city council or having community forums or talking to anyone and everyone we could think of, and really saying that the time has come for people with developmental disabilities to be able to get the supports they need, just like people with intellectual disabilities can in DC. And thank goodness, Councilmember Nadeau and other council members, took action to address this need and pass this absolutely fantastic and monumental legislation. Next slide. Oops. There we go. So what does this law actually change? So as of October 1st, so it's not effective right now. The law has passed, but it doesn't go into effect until the fiscal year starts on October 1st, 2022. And it says that adults with developmental disabilities will now be eligible for services from DDA. And as you heard from a council member, the congressional review ended today. So it really, and that was we just happened to plan the forum today, but what a great thing to celebrate that it actually goes into effect today. And thank you to DC City Council. Thank you for the mayor for funding this legislation. And certainly thank you for Congress for not taking any action and letting it go forward. So we truly, truly appreciate it. Next slide, please. So here I am talking about people with developmental disabilities qualifying for services, but what does that actually mean? What is a developmental disability under this law? There are definitions of developmental disability. There is a federal definition of developmental disability that is listed in the Developmental Disabilities Act. This definitions is a little bit different, but it reflects a lot of the components and criteria of the federal law. So under this law, under the DC law, a developmental disability is defined as, and I broke it down into several pieces because it does have several pieces. The first is a severe and chronic disability. So that means a pretty significant disability that is attributable to a mental or physical impairment other than the sole diagnosis of mental illness. And I'm going to get to that in a little bit. Or a combination of physical and mental impairments. And that is manifested before the person turns 22. So that means it came about before the person turned 22. So it could have been something that they were born with. It could have been something that happened later. As long as it happened before their 22nd birthday, it is considered to be a developmental disability. It is likely to continue indefinitely. So this is an injury or an impairment that's happened, but maybe the person needs some surgery in a couple of years and then everything will be fine and they won't have many issues. Then it would not qualify as being a developmental disability. It might be a disability, but it wouldn't be a developmental disability. Next slide, please. And here's sort of the meat of the definition. So it's a physical and mental impairment. It's severe and chronic. It occurs before age 22. It is likely to continue indefinitely. And then it must result in substantial functional limitations in 3 or more of these following areas of major life activity. So that there's 8 of them and you just need 3 of them. So you need to be able to check 3 to be eligible for services. So the first one is self-care. So your ability to care for yourself, take care of your hygiene, understanding and use of language. Number 2, your ability to express your language, your ability to understand language. Number 3, functional academics, your math skills, how you do with reading comprehension. Number 4 is your social skills. So are you able to interact appropriately with others, whether it's friends, family, strangers. Number 5 would be mobility, your ability to mobilize and get around. Number 6 would be self-direction. So that's the ability to sort of to guide and choose your own life and your services and where you live, make decisions about your own life. Number 7 is capacity for independent living. Are you able to sort of pay your bills, being able to react, being able to sort of run a household and know what is required to do so. And then the last one is health and safety. So do you know how to make medical appointments? Can you do that? Can you call for help? Do you know when you need to reach out to a doctor for something? You know when you need to go to the emergency room. So it doesn't have to be all of those. It just has to be 3 of them. Next slide, please. So what developmental disabilities are covered under law? I think this is important. People, have asked me, so, I have this disability, or my family member has this, or my client has this disability. In the law, it does not say, there's not a list of disabilities that qualify for having a developmental disability. So then there also is not a list of things that do not qualify for having a developmental disability, except for one, which I'll get to next. Instead, you have to look, do I have the criteria? Do I meet the criteria for the law for the definition that I just went through? And that's how you determine if you or whoever your help applying for services actually would qualify for services from DDA. Next slide, please. Like I said, there is an exception. And this is for people who solely have a psychiatric disability or mental illness. Those folks are not actually eligible for services from DDA. So let me explain who that is. So just say there is a person who developed and is diagnosed with schizophrenia back when they're 16 years old. That's all they have, though. They have schizophrenia. That's what they're diagnosed with. They don't have any other developmental disabilities. They don't have an intellectual disability, but they did develop schizophrenia before age 22, right? Because they got it at 16. It is a severe and chronic. It is a mental condition. But though that individual and individuals in that person's circumstance will not be eligible for services for DDA. They are eligible very likely for services from the Department of Behavioral Health, DBH, but they cannot get services from DDA. They will not be eligible for services. But just say that same person either is diagnosed with schizophrenia at age 16, or maybe he or she is diagnosed with schizophrenia at 25. But they also have another disability that would qualify as a developmental disability. So just say they're autistic, or they have an intellectual disability, or they have another developmental disability that would meet that criteria. They are eligible for services, even if they also have schizophrenia. And as you probably know, DDA serves many people who are dually diagnosed with both a psychiatric disability and an intellectual disability, and that won't change with developmental disability. So I just want to be clear that when it says that people, there is an exception for people with a psychiatric condition, that is only for people if that is their only developmental disability or their only disability that they currently have. Next slide, please. I just wanted to talk to you about some other changes, just so you're aware that there were some other changes that were made in this law. This law also changes the definition of what an intellectual disability is. So currently, under the current law, to have an intellectual disability, it had to be something that manifested before the person was 18 years old. That is now changing, and it will be prior to age 22. So it will actually be the same as developmental disability in terms of when the age of onset is. And that really is going with what best practices is and what the rest of the country is often looking to when diagnosing an intellectual disability. In addition, in terms of how it is defined, it will now refer back to what's called the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. And that is basically a book of diagnoses that is well respected by the whole country that describes what is the criteria for certain disabilities. And so The law says that what intellectual disability is defined as is whatever the current DSM defines it as. And so currently the DSM, the one that is out now, says that for someone to have an intellectual disability, they have to have an IQ 2 standard deviations below the mean, which I know is a lot of words that probably mean nothing to most people. But basically what that means is the IQ is somewhere between 65 and 75. And it also still requires adaptive functioning for the person to have some adaptive functioning deficits. And so if the DSM changes, then the definition will change. So it will hopefully keep abreast with how the community actually views the definition of intellectual disability. Next slide, please. Okay, so what types of services will be available for people with developmental disabilities starting on October 1st? The law does require the district to seek amendments to their Medicaid home and community-based waiver to include people with developmental disabilities in addition to people with intellectual disabilities. What that means is that all the current waiver services, so all the community-based services that people with intellectual disabilities are currently qualifying for, people with developmental disabilities will qualify for. And that's in both the IDD comprehensive, sort of the big waiver that's been around for for many years, and the IFS, which is the individual and family support waiver. That is a newer waiver that came, I believe, in end of 2020. And so that will also be amended so that those services are also available to people who meet the criteria for developmental disability. I did want to make sure that I let people know, though, that the law does not require the district to increase the number of waiver slots that are available. And so you may or may not know that there is a cap on the number of waiver slots the district submits to CMS and says this is the number of spots basically in the waiver that we are able to offer to people. And so although DDS has increased the number pretty much every year, so it goes up a little bit higher, they're not increasing it in addition to that for people with developmental disabilities. So there are currently plenty of slots available in both the IDD and the IFS waiver. So if somebody was applying and they were eligible, they should be able to get a slot. But going forward, it is possible that at some point there may be a waiting list for services. Okay, next slide. And the last thing I just wanted to mention is something that is called the grandfather clause. That's what it's called in the legislation. And what all that means is that people who are currently found eligible for DDA services will not have their services altered or impacted in any way by this new law. That was very important, certainly, to everyone involved in advocating for this, that we wanted to absolutely make sure that these services were equally offered to people with developmental disabilities, but certainly done in a way that the people who are currently getting services, who are currently eligible for services, are not impacted negatively in any way. It's now these services, these community-based services that really help people live successfully in the community and work in the community, will now be available to all people with developmental disabilities. And thanks to City Council and the Mayor for passing this, and all the advocates who worked for it. This will now be available to so many more people who really critically need it. And
Sandy,
yes.
Sandy, before you go, I want to ask you two clarifying questions that have come up in the chat.
Sure.
First, can the qualification under the activities of daily living be as a result of developmental disability and mental health disability if the mental health disability occurred after age 22?
I think you'd have, that would be on a case-by-case basis. I think, it's hard to really figure out if somebody's, generally they will have to have adaptive functioning deficits likely that occurred before they turned 22 years old. So if those were deficits that only developed later, possibly not, but it's not always easy to determine. It's not like a light switch that goes off and all of a sudden, you can tell which adaptive functioning deficit comes from which disability. But generally, to have the developmental disability, you do have to have those substantial functional limitations. They had to have occurred before the person turned age 22. And then they could also have a psychiatric diagnosis on top of that.
And then the other question is whether you could please clarify what the differences between the law going into effect, the bill becoming law today, and it going into effect October 1st. And I've already mentioned in the chat that Director Reese will speak more about what DDS is doing now, but if you could just talk about that distinction and what can go on in the interim also.
Right. And so this law was passed, but was with the idea that it was not budgeted until October 1st, which is the beginning of the fiscal year. So it is passed, but it doesn't become effective until October 1st. And we're certainly going to hear, hopefully, Director Reese is in from his fire drill, or hopefully that's all it was. He'll be able to talk when people can apply. We understand that people will be able to apply before October 1st. We're not sure when. But they won't be able to start getting services because in addition to it's not budgeted for until October 1st, the district also has to get approval from CMS to amend their waiver. And that hopefully will also happen by October 1st. And so they have to submit a lot of papers to the Centers for Medicare and Medicaid Services, CMS, and say, this is how we want to change our services. This is how we're changing our definitions before they can actually do so.
Thank you, Sandy, for all of this very valuable information. And we will have more of an opportunity for questions on this towards the end of the program. But we are now going to hear from Rhonda White, Quality Trust Family and Community Engagement Liaison and Family Ties of DC Program Coordinator, who will share information about the types of services that are available from the Developmental Disability Administration. It's all yours, Rhonda.
Right, thank you, Robin. Good afternoon, everyone. And I have been given the task of doing an overview of the Intellectual and Developmental Disabilities Home and Community-Based Services. Just to give a little background of who I am all of those things that Robin stated, that I am the Family and Community Engagement Liaison at Quality Trust for Individuals with Disability. And as well, I'm a parent. I am a parent of 4 children, and my youngest daughter, the self-proclaimed musician, is diagnosed with an intellectual and developmental disability. So because of my history as a mother and from a personal perspective, as well as from a professional perspective, I've had the opportunity to also coordinate and manage the Family Ties of DC, which is a parent matching program for parents of children any age, youth or an adult with a disability with another parent to connect for information, resources, emotional support. So I'm glad that I'm able to participate on today on behalf of Quality Trust. We are elated, as well as the parents that I support, and I'll speak on behalf of all of the DC parents that were looking for this moment, our children who were looking for this moment to happen. And with that being said, not only are we glad that it is now available for those youth and young adults, rather, that have developmental disabilities, we also have to make sure that we understand what are those services that are available. And those services that I have put together on today have been categorized in 4 areas where I will go through and give a very brief overview in these 15 minutes. But I will discuss about the residential settings, the day and vocational services, and the clinical services and assistive services. Next slide. And when we think of the residential settings and the services there, I think families and parents have to think about where do they want, where does their loved one desire to live in DC and what that looks like living in DC. And with the residential habilitation, those services are provided for 4 to 6 adults in a family style home, provided by a licensed, an agency that provided a licensed home, meaning that the Department of Health, it's a licensed community residence home. That is one setting in which someone could live. Another developmental disabilities. And this provides them informal, they may have limited informal supports and have been assessed that they need assistance to develop skills across the activities of daily living, and require assistance with the development of social and adaptive skills. And the third, the host home. And with the host home, we are talking about those individuals who would be able to reside in a home that is a maximum of 3 people. But in this particular case, they are able to choose a person that would be, that's unrelated to them. It's not a spouse or a guardian, but that is there in the home to provide the host and caregiving in that particular setting. And the last one is the in-home supports. In this setting, it's typically the family home. It's where the person lives or has grown up and continues to live in that home. And this is an opportunity where they could get all of their supports from the parent or the family member in this type of home setting, which sometimes has been known to be called natural home. Next slide. The next group or category of services is day and vocational supports. And I think a person would really think about in this particular category about the services that will help them with their doing daily activities in the District of Columbia. So we know that we want our young adults, our adults, to be active in their community, getting jobs and have competitive work. So there is a need to have some supported employment, meaning that there's support to give them job coaching, travel training, maybe some customized type of employment, so that they are able to have access to those supports, as well as employment readiness, which really is learning those basic work-related skills to acquire or retain a job. And that's another area in which services are provided. And then we also have day rehabilitation services, which are aimed at developing the skills and support to be out into the community, that be integrated in the community outside of their home. And as we go on to the individualized support, day supports, that is an area in which the person is giving specific individualized day supports for that particular person. And this can look like different things for each person, because all of these services are provided based on person-centered supports and services. So it's important that we are looking first and foremost to the person to let us know what their strengths are, what their needs are, so that as we're looking at the services and supports available, we are able to cater those supports to meet the needs. Next slide. We also have clinical services. Now, these are services that will, help the youth, young adults to support them in their health. And one of those areas is the wellness services. That addresses fitness, nutrition, sex education. Those types of services will be offered, as well as we have the speech and hearing and language. Those are therapeutic opportunities to address speech disorders, communication disorders, to maximize a person's expressive and receptive communication skills. Well, we also have the physical and the occupational therapies as well, and dental services. These are all services that will allow, help someone to maintain their health and make sure that their health is being monitored and cared for throughout their different transitions. With each person, their lives change, things change. As we all know, we all stepped into the pandemic together. And what we knew before the pandemic and what we needed and the adults that we support needed is very different for most than it is today. And so looking at all of these services and ensuring that we're looking at what is needed and when things change, that we change the plan to make sure we are supporting them. The other supports are behavioral supports, preventive and services that focus on long-term behavioral supports to improve and maintain a person's long-term health and improve their behavior so that there's independence and they're being included in their community. And then we have skilled nursing, which is nursing that is medical and preventive care that is being given for very serious health situations, conditions, and making sure that they are managed. And if we move on to the next slide, I think I forgot something, the creative art therapies. And that's another opportunity in which a person is able to do dance therapy, music therapy, all of those types of therapies that involve the creativity of the person and giving them the counseling and therapeutic needs that they need. Next slide. And then we finally have made it to the last category, which is assistive supports. And I look at this particular category as what is the assistance that is needed for a person to do their activities throughout their life. Let's think of assistive technology. It could be technology that's helping them to remember to take their medication. It could be something that is, used to be able to notify them when there's something, if they're in danger or there's an emergency. It could be a service animal. Assistive technology is really, in some ways, a broad category that really has to be customized and thought about specifically for the person. We also have companion services. It's a designated person who assists and supervises another person to support them to reach their personal goals and desires. And that's all according to what their individual support plan has designated. Family training is coaching and training for the family members, caregivers, focusing on how to improve how they support the person in a better way. Maybe it's the way in which they may be offering some medical or prescriptive prescriptions to them and how they do that, and making sure they are using the proper procedures and steps to do that. Also, family training is just understanding what is needed for their loved one, what is needed to support them. And understanding and maybe receiving that training to get a better understanding. Parenting skills. Now, this is for those individuals that are parents and that need the training to learn the appropriate parenting skills, training on areas of health and welfare and developmental needs of their children. That's another area. And as we are coming to a close, personal care services. Those are activities for the services needed for the activities of daily living, which is bathing. It could be meal assistance, mobility, dressing, grooming. And also there is personal care services as well that involve things that may extend out beyond just those areas of dressing and grooming. There may be some things that someone does every day that a personal care is needed to assist them through that activity. And then last one is respite services. This is a service in which there gives them time of relief for the caregiver who is providing all the supports and services for their loved one. Last slide. And as I have quickly tried to give those a summary and brief overview of all of those services and supports, I have a couple of documents I'd like to share in the chat that will help to give more extensive descriptions of all of those supports and services. Of course, as I stated from the beginning, I am part of and manage a program to support families and parents. And so that is also an avenue in which we can support another family in answering some of these questions. And it's not limited to just what we're talking about today, but if there are other areas of support that we can give, as well as Quality Trust is as a whole is prepared to also support in any way. Thank you.
Rhonda, thank you so much for that comprehensive overview. We've had a couple of questions come up in the chat around how the services are managed and evaluated, and I'm going to suggest that we hold that for the Q&A session at the end, so several speakers can weigh in on that because it is such an important point. So thank you very much. And now we're going to turn things over to Allison White, the Executive Director of the DC Developmental Disabilities Council, who's going to introduce and moderate our next panel. Thank you, Allison.
Hi, everyone. Thank you so much, Robin, for that and for all your efforts putting all this together. My name's Allison White. I'm the Executive Director of the DC Developmental Disabilities Council, and I'm very happy to be here today moderating this panel because this issue is really important to us as an organization. The DD Council's advocacy and programs are for all people with developmental disabilities in DC, and we have always wanted to serve the broader community, not based just on IQ. So this issue has been really important to us for a while. We pulled this panel together to hear directly from people with developmental disabilities and their families to really put a face to this issue. This issue affects a lot of people, and we really wanted to bring that home and hear directly from people what their experiences are. And I am going to start with Julia Bascom. So happy to have Julia here today. I'll give her a minute to get spotlighted. So Julia, thank you again for being here. You lead the Autistic Self-Advocacy Network, and I just want to shout that out first because I love the work you do. Autistic Self-Advocacy Network is awesome. Go look it up if you haven't heard of them yet. So to begin, can you introduce yourself, tell us about the supports you use on a daily basis, and talk about how this change in eligibility for services may affect you or others in DC who have similar needs?
Yeah, thank you so much for having me here today. My name is Julia Bascom, and I'm a DC resident. I'm a white woman with brown hair and glasses. I am autistic and I have other disabilities as well. And when I heard that DC was expanding eligibility for services to people like me who don't also have an intellectual disability, I was so excited. I want to tell you what this policy could mean for people like me. Because of how my autism works, I can't live on my own. I need help every day, but it's not safe for me to live with my family of origin. So when I first left home, I tried to live on my own for a few months. And even with my friends trying to help me, it was a really dangerous situation. I really struggled to take a shower or eat or go to work. I got very, very sick and very weak, and I thought I was going to die. Thankfully, I had a friend who was willing to become my roommate and provide me with daily live-in support. So for the last 9 years, my friend has provided me with substantial support every day. And because I have that support, it means that most days I eat enough meals and like at least one vegetable. I take my meds, I take a shower if it's a shower day, and I go to bed before I collapse. If I need medical care, I can get it. And these things have not always been true for me, and they're never things I can take for granted. My roommate support keeps me alive and it makes it possible for me to work and to have a good life. And the person who supports me deserves to be paid for the work that they do. But because I don't have an intellectual disability, I just have autism, I haven't qualified for DC Medicaid. So there isn't any funding for my support. I have to rely on the kindness of friends, and my friend who provides the bulk of my support has to work a second full-time job. And that's wrong. And it also means that if my roommate has to work an evening shift at their paying job, I might not be able to eat dinner that night. That's wrong too. I guess before I go further, I know that sometimes people are surprised to hear how much support I need because I can talk and I can use big words and I have a fancy job. And I just want to say that this is actually pretty normal for autism. We have a lot of research that shows that autistic people, even with really high IQs, can still struggle with things like executive functioning and daily living skills. So for me, that means that I can do a lot of policy work, but I can't follow the directions to give myself a COVID test. My roommate has to help me. Every autistic person is different, but most of us need some help with daily living. And if we need help, we should be able to get it. And we shouldn't have to rely on unpaid friends and family members to be able to do things like take a shower or go to the grocery store. I don't like to talk about all the things I can't do or all the things I need a lot of help with, but I really want people to understand just how important expanding eligibility for services is. So here are just some of the things I need support to do. I need support to remember to eat enough meals during the day, to figure out what I can eat, and then to actually go get the food. I need someone else to cook most of my meals. I need prompting to take a shower or brush my teeth. I need someone to make sure I go to bed. I need someone to remind me to change my pajamas and take my meds at night. Oh, there's an echo. Oh, it went away. If I get really, oh, I'm sorry, someone has their audio on. Where was I? If I get really upset or overwhelmed, I need someone to help keep me from hitting my head. When I get hurt, I need help remembering to go get an ice pack or a heating pad or take ibuprofen. And when I don't have that help, I do things like walk half a mile on a broken ankle. I need help going to the doctor. I need help running almost any errand. I need someone else to do the grocery shopping because it gets too overwhelming. I need help scheduling appointments and filling out paperwork. A lot of the time at night and sometimes during the day, I freeze in place and I have a hard time moving. And I need someone to prompt me and coach me to get me moving again, or I can be stuck in the same place for hours not doing anything. And what I think is most interesting about that list is that until this new policy, until the law changed, DC didn't think I needed any help at all. And this isn't a list of everything I need help with, they're just some examples, but I really hope these examples help policymakers understand that the services that would be made available under this new law aren't luxuries or things that are just nice to have. They're necessary for survival. Without support, I can't have a good life. If I go too long without support, I could die. The last little bit I want to say is that a lot of the time when Medicaid provides support, it only provides support for physical help or only for things like eating and bathing and transferring. And if you need support besides physical help, or if you need help with things like cooking or going grocery shopping, but not with actually eating itself, you might not qualify for services, or you might only qualify if you have an intellectual disability. So in the past, when I've applied for Medicaid services, I was told I didn't qualify because I don't need very much physical help and my IQ is too high. But that doesn't really make any sense. If I can't go grocery shopping and I can't cook, or if I won't eat without reminders, it doesn't really matter if I can lift a spoon to my lips by myself because there's not going to be any food on that spoon without support. It doesn't really matter how you score on a test if you can't feed yourself. I'm really glad to see that DC is recognizing that and making it more possible for people like me to get help without needing a certain IQ score. But how successful this change is will depend a lot on the details. How are people with disabilities going to be assessed? Who will count as needing enough support? I believe this policy will fail if in October, when it's implemented, it still leaves people like me behind. The assessments and the tools that DC uses have to recognize all the different ways that people might need help with daily living and not get distracted by other things. In the end, I might not benefit personally from this policy, even if it's done well, because since my roommate supports me and I can have a job, I make too much for DC Medicaid. DC is one of the only places in the country without a Medicaid buy-in for workers with disabilities. And I hope we can come back and fix that really soon. But even though I might not personally benefit right now, I know that I'm not unique. Like I said earlier, most autistic adults need some kind of help with daily living. Some of them need a lot more help than me, and some of them need a lot less. Some of us also have intellectual disabilities and are already getting services, but the rest of us have been waiting. All across the district, autistic people and people with similar developmental disabilities are wishing we had the support we need to move out of our parents' homes, to be safe, to work, and to live good lives with our friends. So thank you for making that possible.
Thank you so much, Julia, for sharing, sharing your heart with us and your experiences. I know that it's really helpful for people to hear all about that. So we might have some follow-up questions if we have time, but I want to move now to Renee Davis. Thank you for being here, Renee. And I know you're here because you are a mom of an awesome young adult. So we'd love to hear about your experiences as a family member. So can you start by introducing yourself, your name, where you live, and a quick visual description?
Yes.
Whatever you're comfortable sharing about your young adult.
Good morning. Can everyone hear and see me adequately with the?
You're
My
good.
name is Renee Davis, and I'm a native Washingtonian. I'm about a 4th generation Washingtonian, and my 2 children, Alexa and Mike, are 5th generation. I'm wearing today a black sweatshirt that says with a guitar logo, Girls Rock DC, and I'm African American wearing glasses. Today, I really wanted to make sure that I include in my description that I am an African American young person who's parenting 2 teenagers who also present visually as African American kiddos, because I really want to show that we can present that there is a unique perspective to having young people with disabilities in DC. And it doesn't always fit the national narrative of disability only occurring in certain communities, or disability not really being acknowledged within the African American or Afro diasporan communities that me and my neurodiverse family represents. But before I speak, I just wanted to give you some background information as to why I lended my full support in my 4 recommendations that we have this legislation, the Developmental Disability Eligibility Reform Act of 2021, and that I want to continue to work in the disability community as a parent of advocates, as a self-advocate, and just kind of going on for the future of my kids as well. My children's disability presented itself in the medical side of the community. So they were diagnosed within the context of a medical side of autism, where their limitations were really apparent because they had limitations in communication. But again, because we were able to get an early diagnosis in place for both of my children, my daughter in particular, diagnosed back in 2008, her experience really sets the tone and the challenges that we need to face as we go into this next stage of expanding access. Because as an African American young woman, she'll be turning 18 this year. She really does present some unique challenges because people with disabilities in general, but women with disabilities in general, have a higher incidence of needing supports, so in a way that we really want to support them so that they don't become a statistic. They don't, we are already more likely to have adverse health outcomes. We're already more likely to have attract the attention of victimization and crime. So, and one of the reasons why I think this change is really timely, again, is that although our educational system in DC was able to quickly identify her autism and place her in a private school placement, she's going to still struggle to continue to attain a high school diploma. she's going to continue to struggle because we already know through her medical diagnosis that she's going to continue to need supports in basic healthcare, like having healthcare management. And then outside of having an educational system, she's going to also need supports with living, with maintaining her personal care. And also, we also have this question of being able to participate as an 18-year-old in youth employment. So one of the subtleties of having this new ability to look at her application for DDA be really important to us is that we were really concerned that without being in the adult side of the disability program, disability services in DC, she wouldn't have the ability to hire her own staff to support her with daily living. She wouldn't have the ability to continue with workforce development services beyond her high school diploma, beyond high school exit. And again, one of the reasons why we want to set the tone for this in a way that really prioritizes the needs of youth and teens with disabilities being looked at in a different way is that we want to give them a chance at maintaining a full economic life and a full vibrant opportunities in this city. You know, we don't want people to be thinking that, well, my kid is no longer in school, there's no more services. Maybe I have to go move and relocate to Maryland, or maybe I have to go move and relocate to Virginia, and then have to start the cycle of applying for services all over again. So I'm going to, again, I do a lot of testifying / speaking on behalf of my children. But today I really wanted to just say thank you to all those on the call to giving me the opportunity to provide an alternative face, an alternative pathway, and in some ways an alternative view of why the district needs to look at this change as a positive thing to really capture the talents and abilities of youth with disabilities in this community so that we can move forward. Thank you, everyone.
Thank you, Renee. That was beautiful. I love how you ended that. What we're trying to do here is capture the talents and skills of everybody in our community and make sure that everyone has the support that they need to let those talents and skills shine. So I love that you said that. Thank you. And thank you for sharing your story personally with the community here. So I'm going to move now to my friend sitting right next to me. We have, let me make sure I get the camera set up right. Edmundo and I both agreed that an in-person, a Zoom call would be more fun for us. So I want to thank Edmundo for being here and also acknowledge I forgot to give a visual description. I apologize for that. So I'm here. I am a white woman with short light brown hair. I have a hot pink shirt and a green sweater on. And I'm sitting next to my friend Edmundo, and I'm going to give you a chance to introduce yourself and a quick visual description.
Okay, well, good afternoon, because it's already past 12. And my name is Edmundo Ramos. Yeah, I am a young man with a disability, and I am glad that now that I have a job at Dollar Tree.
So Edmundo and I have been talking about his job a little bit. So can you say a little bit more about what that job means to you and your journey to getting the job in the first place?
Okay, what this job means to me is that I have spent it about 3 years and 3 months hunting down, should I say, finding jobs for me to be able to have a real experience into working in a real job site. Because in the past, I used to work for the Summer Youth Employment Program, which only lasted seasonal, and I know that was not good enough for me because it was not like a full payment. It's not a job where I could get taxes. It was only for experience for young people to be able to know what's it like working at a real job. And what this job that had done to me is that it had made me to change my mind into not thinking about not just working for a while, but able to work there like a part-time or full-time. I got the experience when I helped the Dollar Tree to able to set up it's a store with all its shelves, items, and also having to have a real interview with a real manager. It was very cool for me to able to experience that, and also for me to able to earn to get paid for the work for the hours I done, and also having to see that I'm starting to get to somewhere that which I could start adding this job to my resume. And I know that also I had help, and also I couldn't get this job without the help of a job coach, that his name is Arnolfo Marquez, that he works for an agency called Souls, Arts and Souls. And that venue has been mentioned by RSA, that which I like to give thanks to my RSA counselor who have referred me to those people, because they were my only hope that I could able to find a job.
So Edmundo, one of the things we were talking about earlier was how great it was to have the support of that job coach, and how important that was for you getting the job in the first place and learning the skills of what you needed to do on that job. So in thinking about the kind of support you need to keep that support going on your job, so that you can keep this has been such a long journey for you already, and now you're in it, you have this job and you really feel good about it. What kind of support do you think you need longer term to keep what you have?
Okay, the support that I need to have this job for a longer time is by still having my job coach to always be available when I need him, because I see that he used some very good, I should say, resources, and also a good techniques to able to help me out, and also I see that I need him a lot, because when it comes to, because when the time comes that where I feel like I want to work in a different job, I'm gonna need him to be able to find that new job that we're not able to do alone, because it's not very successful for me to do things alone. I need a couple of hands, or say two heads are better than one.
Awesome. Well, thank you, Edmundo, for sharing all of that. Thank you to all of the panelists, Julia, Renee, Edmundo. Your stories are powerful and they're important, and your experiences are important, and you're the reason we're all doing this work together. And I really appreciate you all coming and sharing today. And I will throw it back to Robin.
Thank you, Allison, and thank you, Julia, Renee, and Edmundo. That was really both powerful and so helpful in really giving people a sense of the meaning of these of the supports and services that we're talking about. And I'm going to join Allison in apologizing for not doing a visual description, and I'll do one late. I'm a middle-aged white woman with gray silver hair and rimless glasses, and I'm wearing a black and white dress in a herringbone pattern with a red necklace. And I apologize for not doing that earlier. And now I'm going to turn to our DDS director, Andrew Reese, and who's joined by Deputy Director Winslow Woodland, who will share information about how and when people will be able to apply for DDA services using these new eligibility criteria. It's all yours, Andy and Winslow.
Thank you very much. And just in line with, and see, if I had known I'd had to describe, I would have worn colors I knew. So I'm Andy Reese. I'm the Director of Department on Disability Services, and I'm wearing a tie that I would describe as sort of orange and blue, and a gray suit. I have more gray in my hair than I like, and wear glasses, and I am white with a goatee. And Winslow Woodland is the deputy director. He's here with me.
I've never done this before. My name is Winslow Woodland. I am, my skin is milk dud color. If you've ever had one, I have a bald head, a slight beard, and I have on a royal blue short sleeve shirt.
Short sleeve DDS shirt. So we are going to talk today about two things: when and how to go about applying for services. In terms of the when, I'll start with that and then turn it over to Winslow, because there's a lot of, unfortunately, people may have known, we had to step out for a few minutes because our fire alarm went off here in the building. So I didn't hear Sandy's presentation. I heard people referring to the law having become effective. And by our calculation, it becomes effective at somewhere around June 12th, because that's the 30th congressional day. As Sandy mentioned, no one in Congress is doing anything to block it. So that's more of a curiosity than anything else, quite frankly. The number of steps we have to take, other than the law becoming fully effective, is, first of all, although the law will provide for this, we need to ensure that our rules, and most importantly, our two waivers provide for these services. And we are actually in the process right now of developing our waiver renewal for our intellectual and developmental disabilities waiver. And we are preparing an amendment to our individual and family support waiver. And we actually, both of those, the draft waiver applications for both of those are currently on our website. And we have public meetings scheduled on the IFS amendment for May the 23rd at 11:30 a.m. until 1 p.m. And on the intellectual and developmental disabilities renewal on May the 25th from 10 to 11:30. And so we welcome people to take a look. The instructions on how to log into those meetings is on our website, as well as the waiver applications that are extensive. So if you would like to read through that, any questions you have, we'll do our best to answer next week, Monday and Wednesday. So making sure these services are available in the waiver is one piece. Another piece is, as we've heard, a lot of excitement about new services available. We want to make sure that we have more staff in our DDA eligibility unit, as well as some necessary training of our staff around what these changes mean. And so we've already started, our psychologist has already been doing training regarding eligibility, what this means for people with developmental disabilities, how we'll go about evaluating whether someone has substantial functional limitations in 3 or more major life activities. And as part of, we have an ARPA plan, an American Rescue Plan Act plan. And through this, we are going to fund some additional positions for our eligibility unit. And so that plan, the amended plan, was submitted to the Centers for Medicare and Medicaid Services at the beginning of May. And we hope to hear, I expect we'll hear the latest by August about the response on that plan. We are actually have already posted the supervisory position for a new supervisor for our eligibility unit in DDA. And that person we're hoping to bring on board in June. And then we will be posting the other positions in August. Our waiver amendment and waiver renewal applications are both due to the Centers for Medicare and Medicaid Services from DHCF in July. Our date to get it to DHCF is prior to that, but that gets transmitted to them in July. So we have actually already started our communication with them about some of what's included in the waiver, so that this can all be in effect on October 1. With all of that, what we hope is in September to begin sort of opening the door for eligibility purposes. I would say more like the second week of September rather than thinking September 1. We need to make sure that all these things are in place, that our new staff is on board, and that we're ready to go when people get here. I want to just reference one important point that Julia raised, which is that our waiver is a Medicaid program and that the District of Columbia at this time does not have Medicaid buy-in. And so that may be another point of advocacy for folks, another step in our effort to ensure that everyone who needs services in the district is able to access them. Now I'll turn it over to Winslow so that he can talk about the application process.
So good afternoon, everyone. Winslow Woodland, Deputy Director for DDA. And what we are building in terms of process for application is very similar to the current application process, whereby a person seeking service or their representative could reach out to us for assistance with the application, or they can file their application via online method or hard copy. Once that application is received, it's date stamped from time of receipt. Within 24 hours, the outreach coordinator or community outreach liaison establishes a file for that person, and within 5 business days schedules a meeting to conduct a what's a primary person-centered plan for that person, identifying the person's wants, needs, strengths, and identifying current supports that that person may have or receive within the community. And then the application process is then, the application is then forwarded to the intake and eligibility staff. Service coordinator is then assigned to that case and begins to support the person to present any and all documentation that they have to support the eligibility determination. And I'm not going to go through all of the detailed processes involved in the actual application process. However, it is important to note that our concerns are to support people to be able to apply wherever they are in terms of what their needs are, and to be a resource to the person so that when they apply throughout the process that they know what's going on. We have an eligibility policy that says from the date of receipt of an entire completed application, and that's a 45-day timeline that the determination is made, the person would be notified of the outcome of the eligibility determination, and then we would move forward. If the person's determined eligible, then their application case, if you would be forwarded to continuing services. Continuing services service coordinators would schedule meetings with the person and or their representative, supporting people supporting that person in their life to establish the needs of the person, as well as to begin the formative stages of an individual support plan, which would include what the person's wants, needs, and desires are. And I should add that the support plan includes the use of any support the person has, starting with state plan services, community-based resources, natural supports, and then we would get to using waiver services should they be assessed and the person needs them. And from that point, authorizations for services are generated, and the person should, within that time, within a short time frame, begin to receive those services. And there was a question that dealt with the evaluation of services. It kind of touched on the evaluation of services. Once services begin, we have a team of staff, we call them service coordinators. They're required to monitor the actual services, and we use that data to determine whether the person's needs are entirely being met. In the event that there's a small possibility that something's not occurring for the person, we have a remediation process that includes issue generation. We have a team of quality people that step in and begin to sort out the remedy for any concerns with the person's supports that are identified. We review that data monthly to make changes within our quality management system. And so, yeah, that's pretty much what we're expecting should occur October. Well, we'll begin to accept applications prior to October 1. And the anticipation is approximately September 1. And then we're shooting for September 1. But by that time, we don't want to wait until our waiver hopefully is approved and then begin accepting applications. We want things to be queued up so that people won't have to wait and receive the services that they need.
So I have to apologize in some part, sort of the lack of clarity about exactly when in September, as we hire our eligibility supervisor in June and have a firm plan about moving forward in September. I was saying second week of September. Winslow is referring to beginning of September. I prefer to under promise. So, so I'm being a little cautious, but you know, as I said, we'll be bringing on, assuming everything goes well with our ARPA plan, we'll be bringing on all of our new intake service coordinators, as well as an additional community support liaison in August. And so those people will then be able to fully hit the ground running in September.
So thank you, Andy and Winslow, for sharing all of that information with us. We're going to call you back in just a minute to join a panel of people to answer questions. But before that, I'd like to just talk a little bit about our next steps. Could I have the one slide, please? So we plan to organize more of these forums, not only to share information, but really just as importantly, to hear from members of the community about what you want and need, about what our next steps down the path towards equity should be. And we've already seen and heard a couple of things come up with that. We've talked a little bit about Medicaid buy-in. We have a question about how we, in the chat, about how we support youth transitioning out of high school. And those are all things that we can be talking about so that we get that type of feedback in a really organized way. We're going to ask you to fill out a survey. There is a copy of it in a link in the chat. There is, if you have good technical skills, there is a QR code that you can scan on this slide, or you'll be receiving an email if you registered after the program, and we would like you to please fill that out in one way or another. But please also, we want to invite you to share your thoughts with us about what changes you'd like to see, what services you and your family members need and want, what progress should look like for DC's developmental disability community. Give us your feedback in whatever way works for you. We have the phone number and email for the Georgetown USID on the slide, but also please reach out to any of our partner organizations, the DD Council, Disability Rights DC, Quality Trust, the ARC of DC. Thank you all for joining us today and for this powerful discussion and all of the information that's been shared. And I'm going to turn things over to Allison White again, who will moderate the question and answer session. She's had a number of questions come in, but if you have more, please put them in the chat box, or when she's ready for more, unmute and ask them. So Allison, it's all yours.
Hi again, everyone. So as Robin said, we have a few questions. I'm not sure if we'll be able to get to all of them, but I have them written down. I know Robin has them, and we'll make sure to keep track of them so that eventually we can get all these questions answered. There will be and you'll probably have questions once the forum's over and think of it later, and definitely reach out so that we can keep track of all of these things we need to get clarity on. So one of the questions I saw, I believe was already answered, but I just want to call it out. It was, is there an evaluation and plan to coordinate all of the services? Winslow just talked about that, about the service coordinators. They are the ones charged with coordinating all the services that Rhonda talked about earlier in the forum. So If there's a follow-up to that, if you can throw it in the chat, if that doesn't provide the full answer you were looking for, just let us know. Thanks, Tawar. What is the evaluation plan? That was part that was not touched on. So Andy or Winslow, do you want to speak to that? If there's an evaluation plan for the rollout of this new law?
Sure. With regard to determining what services are needed, we have a tool that's called the level of need. And the level of need is an assessment, and it's pretty comprehensive, and it generates what we call the risk report. And throughout the level of need, when certain levels of risk are identified, there has to be a corresponding service. And I want to be clear, the corresponding service could be a natural support, it could be a state plan service, it could be a community-based nonprofit support, it could be, so to be clear, when we conduct this assessment, it generates a risk assessment, and the requirement for ISPs is to have a corresponding service to respond to the identified need. And I'm sorry, when I responded, I thought evaluation was monitoring, because sometimes those words kind of live in my existence. But if the plan is the evaluation, the level of need determines what the person needs, and then we monitor the services once they've been identified.
All right, I see another one popped in the chat as well, but we're gonna, I'll record that and move to this next one that was up a little earlier. Edmundo's gonna help me with this one.
What is the criteria for adults to receive independent living supports and the criteria to receive housing?
It's a very good question. There's a lot of independent living supports available within the community, but specifically with DDA, I want to be clear, DDA is not a housing agency. So when we talk about housing, we, and some people on the call are on a committee that I chair regarding looking for affordable housing issues for people that we support. DDA is not a housing agency. Should a person, through assessment and absolute need for habilitation that includes supported living, residential habilitation, host home and in-home supports, that would be identified in the person's ISP. And so hopefully that answered the question regarding housing. And with regards to the schools, I'm sorry, I missed that point. With regards to the school, we assign 2 community liaison outreach specialists who have the task of being assigned to schools within the District of Columbia. And they begin discussions early on in young people's lives with regard to services provided through RSA, as well as informing parents about services provided by DDA. That is by, there has to be permission from the parents to begin those discussions early. It's not automatic, so I want to be clear. We have outreach people that work within schools that support people who have disabilities.
Thank you. Okay, there's another one I received anonymously a little while ago, and so I want to raise this one. Do you see in eligibility expansion an opportunity for DDA or DDS to change the culture and the approach of its staff on eligibility so that the experience of applicants is better aligned with the helping mission of the agency? Currently, many community members experience the application process as making it unnecessarily difficult for people to be found eligible for the agency's services. The screening process is experienced as focused on finding any excuse to issue a denial letter, rather than one in which staff are seeking to genuinely determine whether an individual has disabilities and needs that the agency can provide support for. This sense is widespread. What can be done to change the culture?
Well, I would say that I believe that my team members work to support people be determined eligible when they meet the current criteria as defined by law. So I don't know if when we talk about creating a culture, if a person applied and they were denied because they didn't meet the current criteria, I could understand where that person may feel that my team members may not have been supportive, but they have a charge, and their charge is to follow the current laws and policies associated with eligibility determinations. And if a person is determined ineligible, we do have a process where they can appeal the determination, and those go to the frontline manager. And if no change in the appeal is made, then it would come to me. And then if the person is still, based on my review, determined ineligible, that person may go to the Office of Administrative Hearings or DC Superior Court. With regard to changing culture, I believe we have a helping agency, and I believe that the people who work here are genuinely seeking to help people wherever they can within the confines of how they can help. We have to follow policy, we have to follow laws. And at this point with the expansion, in terms of changing the culture, I do see it as an opportunity for our team members to broaden their scope and understanding of the wealth of concerns facing people who live with disabilities. And I actually welcome the opportunity. And my team is very excited on the front end in terms of the eligibility team. We've been working to ensure that they've had additional training. And I'm really pleased with the way that they are embracing this expansion. So in terms of culture, we'll have to get back to that at another date after we see what happens. I would really love to hear from people on what their experiences are, what they're hearing about, quote unquote, the cultural shift and change. So.
Can I just also add something to that? And I just want to say I have heard that, certainly that concern also. I'm hoping that with this change in the legislation that will possibly change. It won't be a numbers game. Do you have the exact right IQ? Do you have the exact right diagnosis? As I mentioned when I did my presentation, there isn't a list of developmental disabilities that, if you have to have this one, and if you have this one, you're not covered. So one hopes that they will look at the person and their needs holistically, and to determine if they're eligible for services. But that is a concern that I have heard many times about the intake process. So hopefully moving forward, that can change.
Thank you for those. So I know
I must say for the benefit of the group, those who don't know, if Sandy's heard it, then I've heard it, because Sandy is a strong advocate. Over the years, I've appreciated the opportunity to work with her, and I can honestly say she's sharpened me, and hopefully I've added value to her some sort of a way. But yes, I absolutely understand that people don't necessarily agree with the current way DDA has determined certain people ineligible. I've heard it before. Sandy and I had this discussion before.
We have.
Thank you for that. So we are a little past time. There's one other question that I think is probably on a lot of people's minds about the housing issue. So I want to throw this out there and then we'll close it up. But how is DDS partnering with the DC Housing Authority or other housing resources in DC to meet the housing needs for people with disabilities?
And we'll be talking about that some at our community forum next week. As people may be aware, I don't want to take up all of our time today for a topic that I expect to be talking about Friday the 27th at noon at our community forum. As part of our ARPA plan, we have hired a housing counselor, and the goal for that person has been primarily coordination with the available public housing resources in the district. And one of our goals moving forward in supporting people, and as Julia talked about earlier on, people want to live independently, and part of living independently is helping people access the publicly available resources that are there. And in the past, they haven't been as available a resource, and so we want to make sure that people are accessing, to the extent we can, public housing that is available in the district. People may be aware there are limitations on the availability currently of public housing. There is a wonderful executive director of the DC Housing Authority who's taken on that role for a period of time to turn that agency around. That's Brenda Donald, who some people may recall was previously the deputy mayor. And I'm looking forward to her being successful there. I forget, she had told me how long she plans to be there. And we fully expect her to fix it in that period of time that she is there. So we are working with them. They, early on, when she took over as the director, convened a meeting of various agencies in the district that rely, who serve people who rely on or should be relying on public housing resources, so that we could talk about, as a district, how to better serve people.
And I see Jalen put in the chat the link to DDS's forum. So thanks for plugging that. I hope everyone here will come to that to hear more, so we can all learn together and keep working on this. So we are going to end it there. I want to thank everyone for being here and for all the organizers. Thank you to the panelists. Thank you for all the information and all the passion and beautiful stories people brought. Thank you again.
Thanks, everyone.
Last thanks to Allison, and we'll see you. We'll share information about when we're meeting again. Thank you all very much.